Hey, thanks again, everyone, for being here this morning, and welcome to the School Health Services annual training. You are attending the virtual portion of our presentation, and today we have from HCPF, myself, the Department of Healthcare Policy and Financing. My name is Olga Ginchin, and I'm your School Health Services Administrator. The Department of Healthcare Policy and Financing is the state agency that administers the Health First Colorado program. That is the state's Medicaid program. We also have Tracy Gonzalez here from HCPF. From Colorado Department of Education, we have Omar Estrada and Sarah Blumenthal. From Public Consulting Group, the state's vendor that helps us administer the School Health Services program, we have John Ward, Rose Jensen, Jennifer Pham, and Lori Bob. We also have participants from across the state. If you have just a minute to put your name in the chat and which school district you're with. If you're not with a school district, you can just put which organization you're with and how many years you have been supporting the program. So please put in the chat name, school district or BOCES, and how many years you've been supporting the program, just so we know who's here. Again, welcome. And thank you. Welcome, Lene. Welcome, Cheyenne. And I'll go ahead and hop into the HCPF updates. We have a really packed agenda for you today. I'm going to go ahead and just hop right into things. I have a list of acronyms. This presentation has been uploaded to the School Health Services website. If there's an acronym you don't know what it stands for, you're welcome to go back, look at the presentation, and see what that acronym stands for. New CMS guidance. If you have been with the program for any length of time, you know that we have been waiting for some new guidance from CMS for quite some time. The last time we received any new guidance from CMS was in 2003. So this has been a long time coming, highly anticipated, and it was issued on May 18th. This is a nationwide guidance, so went out to all states across the country. And it is important to note that it is intended to be a guide for states for how they deliver a school-based services program in their states. So what that school-based program services looks like can vary greatly from state to state. If you've ever talked to another state about their school-based services program, you know that it probably is pretty different from the Colorado-based program. And this was the result of the Bipartisan Safer Communities Act. An important thing to keep in mind is that all of these timelines are just proposed and estimated. We will communicate any program changes to you as we get further down the road. Right now, the program is as is, business as usual. Again, this is a 184-page document. There's a lot to unpack here. States are at various stages of expanding their programs. So where CMS may suggest these areas of expansion, Colorado has already expanded in a few of these areas. We were actually listed as an example in the guide. 3 areas where we have already implemented changes are free care. We've already expanded to include a reimbursement model beyond just those IEP services. That includes those healthcare plans, behavior plans, that kind of thing. We've already expanded for free care. Also, interim rates. We already do those monthly interim payments. That's something that CMS is suggesting. We already do those monthly interim payments. We've already also expanded provider qualifications so that you can put more qualified staff on your direct service staff pool list. So those 3 areas, we have already implemented those expansion areas. There are a couple of mandatory changes based on how we're reading the CMS guide right now. There are a couple of areas that we are going to have to change. One is the specialized transportation. The way we're reading it right now, a vehicle has to be adapted, and that adaptation also has to be in the student's IEP for that trip to qualify as specialized transportation. That bus aid would no longer meet that specialized transportation requirement. Again, a mandatory change that we're reading based on our interpretation right now, that adaptation, so something like a lift, a harness, something like that would have to be present on both the vehicle as well as required in the student's IEP to meet that specialized transportation requirement. We would also have to expand the time study for a full year. Right now, our time study starts October 1 and goes until the end of the school year. The way we're interpreting the guide now, we would have to extend that time study to the beginning of the school year. That means that you would probably still be able to fill out those calendars. We know that all the school districts have different first days of school, different last days of school. They have different breaks. You would still be able to fill out those calendars to allow for those different days for different school districts and BOCES. So that is that second mandatory change, that we would have to expand the time study for the full year. Potential changes, things we're just looking at and exploring and interpreting the guide. First, a reduced number of moments. CMS is saying that they might allow for a reduced number of moments. We're looking at that and deciding if that's something that we want to move forward with, if that would actually be a positive thing for this program. We're analyzing that at this point. We could potentially also go back to a 2-day notification. Our understanding over the past few years, when other states have opened up their state plans, that CMS was really preferring a 0-day notification. What we're hearing now, that it's possible that we could go back to 2 days. So if we could justify that, we might also try to go back to the 2 days. But again, both that reduced number of moments, both the going back to a 2-day notification, those are both things that we're looking at right now. Also, flexibilities around direct service billing. The CMS guide seems to indicate that we would no longer be required to submit those services in the MMIS system. That is the Medicaid system for submitting those health services for this program. CMS is still saying that you would have to have that service documentation, that proof of service. So how that would look to take away that MMIS system, but replace it with something else so that you would still have that proof of service and the service documentation. Again, that's something that we're looking at and trying to determine how we could move forward with that. So those are the areas that we have already implemented, the mandatory changes, and then those 2 potential changes. This is the estimated timeline. The new guidance came out in May. That was the previous fiscal year. We are currently in this current fiscal year reviewing the guide and developing an implementation plan. Next fiscal year 2024-25, we would then work with CMS to get those changes approved to the PCAP, which is the document that guides the administrative side of the program, that MAC side of the program, and also the state plan amendment, the SPA. That is the document that guides the direct service part of the program. In fiscal year 2025-26, we would then have a prospective implementation date of July 1st, 2025. Again, how we are interpreting the guide at this point, that CMS deadline for those mandatory changes is June 1st of 2026. I cannot stress more that the school health services program, again, is business as usual. We are operating according to the current rules and regulations of the program manual until those changes have been approved by CMS. So business as usual. Those last two slides that I talked about, we're just trying to give you a high level overview of what could be coming your way. And we will certainly communicate out any of those changes and the timelines associated with them before anything changes. Again, business as usual. Also want to encourage you all, if you have any questions, if you're hearing something as you're reading through the guide, please reach out with any feedback, any concerns. You can email me, call me. I also emailed out a survey when I emailed the link to the new guidance. You're welcome to use any of those avenues to communicate with us, especially if you're hearing something that's concerning out there. We want to make sure that the right information is circulating out there. We don't want any misinformation out there that is, causing you undue stress. And I'm going to pause right there. I know that's a lot to unpack. Again, 184 pages, something we've been waiting for a long time. I'm going to pause right there, and I'm happy to answer any questions you have for me. Anybody, if you've read through the document, if you want to raise your hand, take yourself off mute, give any insights, any questions you might have. Right. Well, I am not going to force you to talk about it, but I definitely want to keep those lines of communication open. So please just email me, call me, fill out that survey. Happy to answer any questions and let us know what you're thinking. The School Health Services Stakeholder Program is a group of staff from across the state that helps us with idea sharing, information sharing, mentorship, training participation. The stakeholder website has what's called an areas of knowledge grid. So all of the main areas of the program and where stakeholders have identified themselves as having knowledge in that area. If you are coming up against a change in your program and you want to pick the brain of somebody who has been with the program for a little while, that areas of knowledge grid is a great resource. Transportation is a big thing. Maybe you're thinking about starting to claim for transportation or switching the way from only specialized to not only specialized, something like that. The areas of knowledge grid is a great resource. It also has regional representation, meeting dates, and contact information. This is a list of our stakeholders. If you are a stakeholder, if you could just please take yourself off mute and introduce yourself, tell us which districts you support. I see Marie has taken herself off mute. Thank you, Marie.
Hi, I'm Marie LeBlanc. I'm in Inglewood Schools. And as you can see from the chart, I support the metro region with Linda and Nancy. And we have not gotten together yet to divide who's going to support who, but know that you can call any one of us. And if one of us doesn't know the answer, we will find someone who does.
Thank you, Marie.
Of course.
And I know they want to hear from you. Stakeholders genuinely want to hear from you. They want to help. They want to support the program. They care about the program. So please don't hesitate to reach out to them with questions, something maybe that you want to filter through them before it gets to somebody at the state. They are happy to do that as well. I think we also have a couple of community partners on here. If you don't mind unmuting yourself and just introducing yourself really quick. Joe and Laura. Yeah.
Hi, my name is Aurora Villarreal. I am with Frontline Education. I am the compliance specialist at Frontline.
Great, thank you, Aurora. And Joe?
Yeah, hello, I'm Joe Kinney. Excuse me. I'm with Kinney Management Services. You can reach out to me with any questions, any concerns you may have with the program. I'd be happy to assist.
Thank you, Joe, and thanks to all our stakeholders. We genuinely appreciate all of the support that you provide for the program. New coordinator mentorship. If you are a new coordinator, you should have already received a welcome email from me, including resources, program contacts, training links. We'll have some monthly mentorship sessions starting in September. Those include fellow new coordinators, a stakeholder representative, maybe you'll have Marie, representatives from CDE, usually Omar, HCPF, usually myself, and the PCG folks usually send someone from the annual side, the quarterly side, also RMTS. I'll send a sign up email, I think this Friday after all of these virtual sessions have ended. So please look for that from me. Then we'll have a more in-depth session during mid-year training. I think we might have 1 or 2 new coordinators on here. If you feel comfortable just raising your hand real quick. And if you haven't let us know that you're a new coordinator, please let us know. We want to make sure that you have the support that you need. We started monthly office hours in April. Those are every first Wednesday of the month at 1. They include any school district or BOCES staff that support the school health services program. They're confidential, not recorded, and those questions can be asked during the meetings, or you can submit your questions in advance on an anonymous survey. The link to the anonymous survey is in the Google invite, that calendar invite that's a placeholder on your calendars. Just click on there and submit any questions ahead of time if you feel more comfortable doing that. And Zoom registration is required. National Provider Identifier, NPI requirement. We've been talking about this for a couple of years now, so it shouldn't come as any surprise that the current requirement is that the district or BOCES NPI is in the referring provider field for PTs, OTs, and SLPs, those services. Now we're ready to move into the second phase of the project with it, which is that individual providers have to have that NPI and be registered as a Medicaid provider. Stakeholders have been working on this since October, and they have helped us develop this guide, a very detailed NPI OPR guide that includes step-by-step instructions for getting the NPI, for also enrolling as Medicaid provider. Again, they are stakeholder developed best practices. This is a live link. I'm also going to email this out after the training is complete. This process needs to be complete by June of 2024. Again, that's required for PTs, OTs, and SLPs. They have to have that NPI and be registered as a Medicaid provider in order to be on that October to December 2024 staff pool list. So I would not wait on this. It might seem like 2024, June 2024 is a long ways away. That NPI part of it, it'll probably go pretty quick for you. It's that Medicaid provider enrollment that is going to take a little bit longer. So you definitely want to get started on this just as soon as you can and make sure that you're getting those requirements met by June 2024 so that you can include them on that OD24 roster. Marie, did you want to share any thoughts that you had on this project? You were one of the stakeholders that helped us pilot this.
Yes, I would say my biggest thought is, I know you've heard many people say this already, but go slow to go fast. Do not let this overwhelm you. You have a lot of support between CDE, between the consortium. There's a lot of wraparound support for you. I did start to roll this out, and then we lost 5 of our 7 SLPs, so I'm starting over. So, but listening to other districts, if you're a larger district, I can tell you that some of the larger districts started off with their leaders. Who are your SLP leaders? Who are your OT leaders? Don't try to capture everybody at once. Again, start slow to go fast and start small to go big. That's what I would say, Olga.
Great, thank you, Marie.
Of
And
course.
even in that NPI OPR guide, there are some templates in there that you can just click on the template, see how the stakeholders tracked how they were doing with those PTs, OTs, SLPs, to keep track of kind of where each provider was at in the process. So I feel like that's going to be a really helpful guide for you all. Thank you again, Marie. National Alliance for Medicaid and Education. The NAME conference is coming up in October, and that's going to be in Dallas this year. It is a great place to share best practices, especially if you want to talk to other local education agencies. Those are school districts or BOCES like yourselves. We have a lot of those that attend the NAME conference. It's also for state Medicaid agencies like HCPF, state education agencies like CDE, and there are also associate members. An example of an associate member is PCG. And really they come from all over the country, represent all the different states that participate, and they do that best practice sharing. So you can attend in order to meet people from other states, and you can also attend to just really further your connections with your Colorado colleagues. We do have a really good representation from Colorado. We're one of the larger representations from different states. So we have that large representation just of people who attend, but we also have a really good representation on the actual NAME board. We have Shannon Huska as your Region 3 State Medicaid Agency representative. Marley Hart is your NAME secretary. Marie, who you have heard from a couple times already, is your program committee chairperson, and I am your membership committee chairperson. You can pay for this out of your administrative budget. Talk to Omar if you have any questions about that. And if you haven't been for a while, if you've never been, I would encourage you to go. There could be a lot to talk about this time with that new guide coming out. So I would say if you haven't been, this might be the one that you want to consider going to.
Olga, can I add something to that?
Absolutely, yes.
I just want to say you're right. If you've not been to one, you want to go to one. Usually we only have like OIG or CMS when we're in Baltimore, but we do have representatives this year that are joining us in Dallas because of the new guidelines. And so there will be a lot to talk about. So if you have any questions, please don't hesitate, reach out to me. If you are, going back and forth, should you register, should you go? It is really a great networking opportunity to hear what other states are doing. And as Olga said, just to connect with other people across Colorado as well.
Yeah, thank you, Marie. And that's really great to say that about OIG and CMS. Those are usually some of the most interesting and well-attended parts of the conference. Very interesting to hear from them, and you learn a lot when you hear from CMS and OIG. Like Sarah said, it's a lot closer to Colorado. I believe there are some really good direct flights from Denver. So really good opportunity this year with NAME. Okay, program reminders. Just a few general reminders. There are some subscriptions available on the HCPF website. Those include provider bulletins. There's an at a glance newsletter, a PHE newsletter. News releases are included as more general notifications. If you only subscribe to one newsletter, please let it be the School Health Services newsletter that comes out on a quarterly basis. If you have any staffing changes, please let us know. We definitely want to make sure that your new coordinators are well supported, but also if you have any support staff that has come onto the program, want to make sure that they are included in the communication that they need for the program. Check out the School Health Services website. We do keep that program manual updated, and it's a very robust program manual. I think it's got a lot of great information in there. We have recorded training sessions. Let's say that you have an individual or an open staff list position right now, and you didn't get them hired in time to come to this annual training. Those recorded training sessions are a great resource to then view after that person has been hired. And please know your contract with HCPF. It does tell you what the program requirements are, including provider billing and HIPAA requirements. So your contract is a very important part of the program to be familiar with. Public health emergency, continuous coverage unwinding. The end of the public health emergency was in May, and that also ended the continuous coverage requirement. We are reaching out to you all because you are uniquely positioned to make sure that families in your districts and BOCES don't lose coverage if they are still eligible for coverage. We've gone over this information before, so it may not be any surprise to you, but it is very important. And I'm going to keep it pretty high level, but I do encourage you to look at the websites that are included on these slides and really do a deep dive. There is a ton of information out there, a ton of resources so that you can support those families in your districts and BOCES. Again, keeping it high level, but please, please take a few minutes and do a deep dive into these resources. Besides just making sure that families don't lose coverage, can you think of another reason why this might be important to you all? You can take yourself off mute, put anything in the chat, raise your hand. Anyone think of another reason why the continuous coverage unwinding is important to you all? These members have not had to complete the redetermination process for 3 years, and now they are having to complete that redetermination process. Any ideas for why else this might be particularly relevant to you all? That's right, Nancy, your MER. And why is your MER important? Your Medicaid enrollment rate. Yes, Marie. Marie agrees. So that Medicaid enrollment rate is applied to every part of your reimbursement. So it directly impacts your reimbursement over all aspects of the program. Again, these members haven't had to complete the redetermination process for 3 years. So you can imagine how that might impact your reimbursement. We have a ton of resources out there. The PHE Planning Resource Center, if you only bookmark one link in this presentation, I would say bookmark this link. Lots of resources out there, FAQs. This is just a timeline of the renewal process from the time that the member receives that renewal notice to the time that they either stay on Health First Colorado or they transition to another type of coverage. Partner messaging toolkits. There are a few toolkits that can help you support families in your district. Take a look at all of these, the Update Your Address campaign, renewal education, and the Take Action on Your Renewal. The Update Your Address campaign, you might want to pay particular attention to. If we don't have the correct address on file, those members are not going to get their renewal notices. So really important to make sure that we have the correct address on file for your families. Those are all available in English and Spanish. We are also going to have those available in 11 additional languages. These are the top languages from our Health First Colorado members. Make sure that your families are aware of the scams that are out there. And the Health First Colorado renewals page also has lots of information out there to guide members through the process as they're actually completing those renewals. I personally have heard the radio announcements to make sure that we're reaching all members. Again, if we don't have their current address on file, we're not going to reach them. So trying to really come at this from all angles to make sure that we're reaching all of our members, including on the radio. There are printable flyers. This is one of those areas where I pay particular attention to. There's a lot of different options out there that you can take a look at to determine what would work best in your school district. I could see these going out in a Friday folder, something like that. And what can you do to help? You can share the renewal messaging, those partner toolkits with members, add messaging about renewals in your emails, newsletters, on your website, share in social media, the social media messages, graphics, familiarize yourself with those partner education toolkits so you can help families in your school districts and BOCES. They keep the FAQs on their website regularly updated, and also sign up for that PHE newsletter. Just in our in-person sessions last week, a lot of our districts were just asking about more data around the PHE unwinding. And we received a lot of data about the PHE unwinding in the most recent PHE newsletter. So definitely sign up for that PHE newsletter. Got a lot of great info out there. And how can we best reach kids and families? If you have any ideas for how we can get to kids and families, please share that feedback with Allison. She is in our communications department. And what questions do you all have for me? That could be anything related to the PHE, anything with the new guidance, the NPI, OPR. I'll just pause here for a minute to answer any questions over what I have presented on. Again, you can take yourself off mute, put your question in the chat, or raise your hand. And of course, I'm always here. You can email me at any time. You're welcome to call me, and you can also fill out those various surveys that we have mentioned, whether it be in those monthly office hours or related to the new CMS guidance. Questions for me?
So
Yeah.
I just want to double check. So we're starting in August when school starts this year versus the August or October 1st.
So that is all the CMS new guidance, but nothing changes.
Okay.
We are operating according to current program manual, and that timeline that I gave you, we have got quite a while before we do any changes to the program. So business as usual until further notice.
Thank you.
Yeah, thank you for the question. And that's a really important point. That was just to give you all an idea of what's coming your way over these next few years. What other questions do you have for me? I don't see anything in the chat. Someone please correct me if I'm wrong, if I've missed anything. But I believe with that, we will transition into our first breakout room where you are going to do an organizational chart activity. And with that, I will hand it back to Rose. Thank you, Rose.
Thanks, Olga. So we're going to do a quick breakout activity like Olga explained, and Tracy's going to break us out into 5 groups. Each of your facilitators has a list of terms. We're going to discuss what those terms are and who you should reach out to with the subjects of those terms within the program, which entity you should reach out to based on the term that you're covering. It's a pretty long list. I think we're going to get somewhere around 10 minutes or so to try to get through as many as we can. And then we'll come back together as a group, a larger group, and discuss a few from each group. And your facilitator will have the list and can explain in further detail if needed.
Okay, I'm going to go ahead and open up the rooms. You should see an invitation pop up on your screen. Please click join, and I will see you all back here in about 10 minutes.
Okay, great. Can you hear me? Okay, Tracy?
Yes, Rose.
Okay. So I think we'll just share maybe 2 terms because I don't think we got through the full list. It's pretty long. We'll just take 2 terms from each group, if that makes sense to everyone. So I think I'll just start with you, Omar. Did you guys cover monitoring the random moment survey completion, and what did you guys get on who you should contact for that one?
Melissa's going to be our share out person here. Thank you, Melissa.
Sounds good.
Sure. So I'm sorry, say the question again.
It would be the first term on the list. So the monitoring random moment survey completion.
So we were contacting the coordinator in our district.
Okay, that sounds good. First line of defense, the coordinator. And then if they didn't know, who would you escalate that outside of the district to?
PCG.
Perfect. Sounds great. Okay, how about the second one? Moments and shifts.
Again, we were going to start with the coordinator, and then if we had additional questions, move on to PCG.
That sounds great. Thank you for sharing. We'll move on to, how about Jen? Jen, can you guys cover terms 3 and 4? So billing platform related questions, and I don't know who your spokesperson is.
Yeah, Cheyenne, would you be able to share out what we got? I think we also put it in chat too.
Let's see. For the billing platform related questions,
Yep. Who would you go to? That would be
our third party biller or the consortium.
right. So if you contracted with the consortium yourself, it would be the consortium, but it could be any biller that a district contracts with. You would want to go to your biller for any billing questions. Yep, that's 100% correct. Okay, so how about number 4, which would be the reimbursement spending report?
And we went with the CDE for that one.
Perfect. So we help you recover those funds, and then CDE helps you spend those funds. So that's excellent. Okay, how about John? Did you guys get 5 and 6?
Yes.
Okay. You want to start with?
I'm sharing out. So I think it depended on 5, depends on what program documentation we're talking about. So it could be HCPF, CDE, the biller, or PCG, depending on what type of documentation. And then 6, the local service plan will be CDE.
Yes, that's great. So I loved your explanation for program documentation. It really does depend in what respect you're asking for program documentation. I think a lot of the program documentation is required for the comprehensive reviews that you guys go through once every 3 years. And that requires all kinds of program documentation, but very specifically in other areas of the program, you could also need to produce some documentation for the program. So that was a good answer. And then, yeah, the local services plan is also, again, what Omar from CDE helped you plan for spending and whatnot. Okay, so let's see, we've got 7 and 8, reviewing service notes from providers, and then staff pool list management. Who did I get yet? Oh, Olga, I didn't get your group. Did you reach it to the 7?
We did, and Nancy is our spokesperson.
Okay.
Yeah, so the review service notes from providers, the billing agent, and PCG. Am I forgetting something else, Olga?
Yeah, we also talked about it could be somebody within the district, maybe who is in charge of service documentation.
Oh yeah,
Yep.
yeah.
But yeah,
Okay, and then number 8, the staff police management would be PCG.
Right. So if you have any questions, because you're doing the management at the district, right? But if you have any questions about specifics, you certainly want to contact PCG and we can help you through that. Okay, so my group would be last. We didn't get to 9. So I would have to reiterate some of the early ones on the list. Actually, I think we did get to the revalidation process. So I think Joan and my group had mentioned HCPF. So when you need to revalidate your district for the program, it would be through HCPF is what we said. And then the random moment time study, that was sort of a softball question. It kind of goes with the first one of the terms on our list, which was PCG, right? Because the time study is managed through the PCG claiming system. So you would want to ask PCG any questions regarding the time study. And that pretty much concludes. I know that was a long list to get through in the time we had, so I think we did pretty good hitting all 10. So I'll turn it over to, I believe, Omar to continue with the presentation.
Thank you, Rose. Okay, so this portion is going to be the Colorado Department of Education. Again, my name is Omar Estrada, and I'll be covering all things related to how those dollars are spent. So this is the planning and the tracking of those reimbursement dollars that you get from the billing side of the program. So I don't have all of the tiles on the screen. If you do have a question, you can go ahead and pop it in the chat, which I am monitoring on my end. We're going to start off first with the local services plan. So for those of you, if you're not familiar with this, this is something that is in statute. It is called the services plan, and it covers a 5-year period. So this is how those reimbursement dollars are going to be spent. This is something that is created with the community. So that community input is also something required in statute through some sort of health advisory committee, or sometimes it's just called the local services plan committee or health committee, where you identify and prioritize those health needs and you look at what sort of budget you're working with using previous cost reconciliation data. Like I mentioned, that LSP is sent over to me. Well, I will provide some notes or go ahead and improve it if everything is in order. So this is all electronic, and you will also be providing a signed assurances page, which can be your coordinator and just lets us know that somebody has reviewed it, letting us know that they've seen the language from statute covering this portion of the program. What you're seeing on the screen is a quick outline. So the first section here is the cover page. This is just general information provided to us. Like I mentioned, that community input is very important. So that second section covers that community health needs assessment. We also make sure to look at the underinsured, uninsured population as well within that health needs assessment. So that information is provided as well. And we also want to make sure that a list of who was part of the conversation is also provided, just to make sure that it is not just a district or just a BOCES conversation to create this LSP. After that, you will get all that information, put together a program plan, letting us know what's going into program administration and what is going into health services for your students. And just a reminder that your program administration, so though you can use these dollars to pay for your coordinator, salary and benefits, any other members on your program admin team, travel, your biller, and so on, we want to make sure to give you, to let you all know to make sure to stay under the CDE recommendation of 20%. Once you do that, you'll go into your goals and objectives, letting us know what your goals and objectives are, what you intend to do with these dollars. And when you're looking at the LSP, I want to also just put it out there how to think about it. Your goals and objectives should be fitting in within your program plan, and your program plan should be fitting in to your community health needs assessment. So you can think about that community input as sort of the umbrella under which the program plan, the goals and objectives should be fitting under. The main question that I tend to get from the field is, what exactly is an allowable expenditure? What can we spend our dollars on? And typically I will say that there are two main items to focus on. The first and foremost, and of course, primary reason is the item that you are spending those dollars on, a health need. So whether it be FTE, equipment, professional development, or whatever it is, it has to be a health need, and you can't spend it on, for example, salary for math education or for general transportation as well. Once that has been determined, you also have to make sure that it aligns with that CDE approved LSP, which, as a reminder, has that community input, which is of course paramount in this process. If you want to dive into this further, we actually did create a support document. We just called it the Expenditure Allowability Support Document, and that covers additional questions on the topic. It covers strategies as it pertains to the LSP, what sort of things you can put in there. And it also has a list of items that have been turned down in the past, or we just recommended to use other dollars. We also made sure to add a reasoning for each one of those items, just so you can look at the nuances of this, of the topic of expenditure allowability. So I highly recommend it. It is on our website. And of course, with this whole conversation, you can always talk to me. I'm also a resource for you all. And since the LSP is a 5-year document, a lot of things can happen during this time, of course. And so we want to make sure to provide an avenue for you all to make changes to that document if needed. So we have an LSP revision process. As long as those revisions still reflect the community identified health needs, you can go ahead and submit a revised LSP along with what we call the LSP companion form, which is also on our website. And that's just going to provide a summary of the changes from the previous version to the new version. So we have a good document history for this document. If those revisions don't exactly align with the input provided from the community, which is again, section 2 of the LSP, we will just request to go back to the community, through that the health advisory committee or Medicaid committee, whatever it's called, just to make sure that we still have a reflection of that community input in the new LSP. And it's important to remember that those LSP revisions are different from the LSP renewals because they don't reset that period. So if your LSP was submitted in 2023, it is ending in 2028. If you do a revision in 2025, you're still within that 2023 to 2028 period. However, if you do an LSP renewal, which happens at the end of that 5-year period, then you are going to go into that new LSP period. So we recommend to leave 10 months just to go through that process, just to have enough time, and reach out to me if you need support during that process. We provide a list of the cohorts, so what 5-year period of your LSP, your district, your BOCES is in. That is also on our website and will be updated in the future as new LSPs come in. Just check for questions. All right. We do have a deadline update for the LSP. So for those of you that have submitted or have been a part of the program for a while, you know that we had to change the submission period for the LSP due to the public health emergency. So for those of you that have an LSP ending in 2023, your deadline is going to be August 31st of this year, so end of this month. However, with the end of the public health emergency back in May of this year, we're going to be also shifting back to the original deadline, which is what you see on the screen. We just formalized it with a final submission being at the end of June or the next business day if it is on a weekend, and an initial review 2 weeks before that final submission. So for those of you with LSPs ending in 2024, that final submission is going to be July 1st, which is a Monday. And the 2-week initial review submission period is going to be June 17th of 2024. Again, if you are unsure, if you're within the 2023 or 2024 cohort, you can reach out to me, or you can check out our website and find your district on that cohort page. So that was the 5-year spending plan, letting us know how those dollars are going to be spent. And within each one of those years, within that 5-year period, we also make sure to track the dollars being spent using what we call the reimbursement spending report, CDE, or just simply the RSR. So like I mentioned, it's an annual fiscal report. It helps us track those dollars. It helps us use that information to create new support tools like the expenditure allowability support document that I recently mentioned. We, of course, share this information with HCPF just for their own data collection. And we also compare this information with the LSP. So we want to make sure that how those dollars are being spent align with the LSP, which was developed by the community, of course. And if there is some sort of misalignment, we just want to make sure that we update the documents that we have on hand. Every year, we make sure to update the reimbursement spending report. So here are just some updates that we have on hand, some minor ones. We always do formatting changes just for clarity. If we have anything that we need to adjust, we'll just do that on the back end. Major updates, however, the first one that I want to address is that first point, which is that we are now going to be reviewing these reports on a rolling basis. So as opposed to the previous years where we waited until that submission period ended at the end of February, we are now just going to be providing those reviews when they get submitted. So within a few days of you submitting a report, you're going to be getting an email with that review from myself. Additionally, there are some help boxes on there that are specific to questions. We make sure to update those so that you have live supports while you're working on those documents. And I'll show an example of that in a little bit of what that question mark looks like. We added a new assurances page just as a final check on a separate page, making sure that the document is accurate and complete. If you were here for mid-year training, I talked about the admin and health service narratives will be required in this next reporting period. So that is also a major change that we made. And I'll be speaking about that a little more in a little bit as well. So I'm going to quickly go over just what the report looks like. These are just screenshots from the actual report. This first section is the cover page, just asking for the name of the district using a drop down and asking for the name of the coordinator on here, as well as giving you an option to save and return if you want to use that feature. This next section is the admin expenditure. So like I mentioned, you can spend these dollars to administer the program. Usually this is your coordinator, Medicaid coordinator, salary and benefits. This is also travel to, the NAME conference, for example, expenses covering your biller's fee. This can all go in here. And you'll also notice in these different questions next to the asterisk, there's an encircled question mark. That is that context specific support box. So if you just hover over that, you're going to get specific help for that question there if you need that support. In each one of these sections, if you look at the bottom left side of this screenshot here, you'll be able to calculate a subtotal for that specific section. All of our areas have that as well. Again, just to make sure to have that for your own benefit. In the health services section, for those of you that haven't seen an LSP before, or maybe this document, we have health service categories. And for this program, it is a matrix. So if you look at this first section under the health services expenditures box, we have nursing, mental health, student health, and so on. Those are your main categories. And you'll also notice the nursing and the mental health box are checked off. This is there's some conditional logic on here. So when you check off those boxes, it's going to populate, for example, you check off nursing, it'll populate that nursing section down below. And if you look at the nursing section, we also have subcategories, which are all checked off. That's going to populate just the report you need to fill out. So it'll shorten the document and make it easier to fill out. At the bottom of this screenshot, you'll notice the category specific narrative information. It's just the text box at the bottom with some additional text on there. We just made sure to pre-fill that section with the subcategories just to help provide that narrative in the report. After that, we'll have a summary of expenditures. So this is just subtotals for what you spent on your total admin, your total health services, your FTE count as well for those health services, and a grand total for the funds expended in that report's fiscal year. So this is again a final check just for the benefit of those completing the report. Right after that, we have a couple questions that are covering the annual notifications requirement under IDEA. We're just requesting to see if those have been sent out, whether they have or have not. And we have a link to the US DOE IDEA website if you want to look further into that while you're completing the report. The question after that is whether or not your district is planning to continue participation for the next fiscal year. Again, just a yes or a no. And if you answer in the negative for any of these, that's just going to trigger a response from me just to make sure to reach out and see if there's any additional information I need to collect or additional support that I would need to provide here. I mentioned a final acknowledgement page. Again, this is just a final check for completeness and accuracy. So you'll see a numbered list on there, and it's essentially asking to make sure that expenditures in this report were just paid for using those reimbursement dollars, the Medicaid reimbursement dollars. The second one is just asking to make sure that admin expenditures are just those covering admin services for the program, administration services. And that third bullet point is just covering for the health services section to just have expenditures for those health services to students. You'll just check off, make sure you have read the information, just attesting to the accuracy, and you'll provide the name of the individual that is completing the report. Again, just to follow up if needed. I mentioned RSRs being required this year. And before I jump into this, I do want to make sure everyone knows that we will be providing a document just for more detailed support when we open up the reimbursement spending report during our annual CDE SHS website update. So that's going to be October 2nd, and we'll make sure to share that info when it comes out. However, just real quickly, when you're thinking about your narratives, we have a little mnemonic on here that's just before you submit, take a sip. And that SIP stands for scope, identify, and purpose. Scope being, are those narrative items covered by Medicaid reimbursement dollars? Identify is making sure that it is something that is uniquely searchable. So if you think about curriculum, instead of saying, maybe SEL curriculum or mental health training, you may instead say something more specific like youth mental health first aid training, just as an example. And finally, purpose, again, just making sure that whether it be a student health or program admin narrative, making sure that it is satisfying a student health or program administration need. With these reports, we always share this information and presentations with you all. So for fiscal year 2021-22, we had about $66.17 million in spending, split $6 million in admin and nearly $60 million in health services, representing 925 total FTE across the state. So those are also the spending split by our health service categories. We provide the total amount in the FTE. Many of you who have seen this kind of data before would not be surprised to see nursing services and mental health, followed by the other categories under that. So we have a similar trend this time around, and the FTE breakout follows a similar trend as well. Right after this, we also provide just the 5-year historical for this information. So we're still in a positive trend. We still have positive growth from the previous fiscal year. So we wanted to make sure to provide that to you all. Finally, we can talk about parental consent forms. So before going into the more recent news of the proposed rule, I want to first provide this reminder that prior to accessing those public benefits, the public agency, school districts, BOCES, must obtain that written parental consent form informing parents of what PII or personally identifiable information may be disclosed, why, and with whom. So this is a requirement under FERPA, or the Federal Education Rights Privacy Act. We also have that written consent under IDEA, along with the requirement to provide parents of their rights, again, under IDEA or Individuals with Disabilities Education Act. And I listed those summarized rights in the screen, but please make sure to dig into this a little further if you want to see the entire information. And I want to provide an additional reminder that this parental consent form concerns the disclosure of PII. So it is not a consent to bill Medicaid. And of course, if you have any questions on your own district or BOCES processes covering parental consent forms or the annual notification practices, please make sure to speak to your legal team. As it pertains to our program, whenever a school district or BOCES goes under a comprehensive review, that is when CDE will come in and review parental consent forms for that sample of students that a district or BOCES receive. And if you all remember on that RSR, we also take a look at those parental notifications just to make sure that they were sent out. Many of you have probably heard of this proposed rule. So I just have the summary on here that the secretary proposes to amend that IDEA Part B regulations to remove the requirements covering obtaining parental consent prior to accessing those benefits. This was back in May 18th of 2023. That's when it was submitted. And we also have the document number on here for reference. So for this, it is important to know that, and also why I bolded it, that this is covering the IDEA Part B regulations. And if you remember on previous slide, we have written consent from parents informing what PII may be disclosed, why and with whom. That's still going to be a requirement under FERPA, the Federal Education Rights Privacy Act. So this is just addressing IDEA Part B. We want to make sure to remind you all that this is not addressing the PII parental consent requirements under FERPA. And just to hammer it home, again, this is still a proposed rule, so nothing changes right now. This proposed rule has to first get those comments, which actually closed August 1st. Those comments still have to be processed. There's still some additional reviews that have to be conducted, and only then a final rule will be published. And once that final rule is published, we'll make sure to take it in, to read it, review it, see what needs to be communicated, and we'll make sure to provide that communication out to you all, informing the effects of this final rule here. So this doesn't change anything. Just keep an eye out for information that may come your way. This is a good amount of information. I know this is something that's been talked about heavily. So is there any questions from you all on this, or any concerns or feelings? Please feel free to share in the comments. Okay, I'm not seeing anything on here, so I'm going to go ahead and move on. If you do have questions, you can always send them my way, and I'll make sure to include HCPF if need be. Back in mid-year training, I talked about an education tool that we're putting together. So this is just a summary of all the support, everything that we have on our website in a more easily consumable way. So if you have a new coordinator, or if you have a new person that's helping with the administration of this program, or if you just need that extra information, this is something that you'll be able to use to catch up on, all the things relating to the CDE SHS portion of this program. This is also going to be sent out, and it's going to be open October 2nd with our regular CDE SHS updates. So keep an eye out for that, and we'll make sure to communicate that when it is ready. I talked about the website update. So we do this every year, big update to update the LSP guidance and templates, our program timelines. This is also when the RSR link is open, so you'll be able to access it then. If you need to go to our website, it's right there on the screen, or you can just type in Medicaid and on the CDE website and find our program page that way as well. Finally, I also want to put this on everyone's radar. We're going to be working on updating those project flyers. So the school district project flyer, we're going to be sending this out at the conclusion of this annual training. So this will be next week on Monday, on the 12th, I believe. And the one that you all received after this training is not going to be updated. So it'll still be similar to what you're seeing on the screen. This is going to be for the fiscal year 2022-2023 flyer. So keep an eye out for that. We always listen to feedback that you all provide us to make these changes, just to make sure that it is a more useful document. So if you have any of those, of course, please send them to me and we'll make sure to collect those. One of the ways that we've already received some of those comments, or something that was already communicated to us, is changing how we do those proud achievements, because sometimes things don't change year over year, so you don't want to have the same proud achievements year over year. So we're going to be taking a look at that and make sure we provide a more user-friendly experience here. Finally, I'm going to finish up with some important dates here. So I talked about the 2023 LSPs. So if your LSP is ending in 2023, you want to make sure to get a new one in before the due date, which is going to be Thursday, August 31st. So the end of this month. So please reach out to me if you have any questions or if you need some additional support, and just to make sure to get this in on time. For those of you that have an LSP ending in 2024, remember that you are on that new deadline submission period. So the final one is July 1st, and 2 weeks before that is going to be an initial review submission period for June 17th. I've already communicated with those that are ending in 2024. So you should have already received an email from me if you're the coordinator or the finance contact. But if you do have questions, if your LSP is ending, reach out to me or check out our website. And I mentioned that RSR report is going to be open on October 2nd, and it is going to close February 29th. So there's a good amount of time there for you to get those in. And you will also receive an email once that opens up with the annual website updates. Finally, I mentioned you'll get those data flyers after these trainings, so keep an eye out for those as well. However, if you would like to see the state data level flyer, that's actually already available on the HCPF website. And if you need additional support on anything I've discussed, or if you just have additional questions, you can always email me, you can call me, or you can just toss something on my calendar using that doodle link that you see on the screen. So there's a number of ways to reach out for me. I'm always here to help you all out whenever you need it. Before I hand it back to Olga, are there any final questions? Anything you would like me to go further into? Here, I'm going to stop sharing so I can see if there's any raised hands or. Okay. All right. No questions. Please reach out if you do. I'll make sure to get those answers to y'all. And back to you, Olga.
Thank you, Omar. Just wanted to take a second to remind everyone that all of the information that we presented, whether it was the proposed parental consent changes, anything with the CMS guidance, those are things in the future, right? We are operating based on the current program manual. That means nothing changes with parental consent right now, nothing changes with transportation, nothing changes with the time study. We are operating, like I said, business as usual, just giving you a high level overview of those things that could be coming our way for the program so that you're aware of them. These slides are already uploaded to the website. So if you need to remind yourself of that estimated timeline, you can always go back. It's going to be several years of all of those things before they are completely in effect. So just wanted to take that opportunity to remind everybody, because it is very important to know that we are operating business as usual according to the current program manual. We'll let you know if anything changes. All right. Our next session is at 1 o'clock this afternoon. If you have registered for the random moment time study session, that starts at 1. Just wanted to also remind you all that the program coordinators for each district or BOCES should be attending every virtual training session so that you see all the different aspects of the program. Other support staff, like if you have finance support staff, they would only attend these sessions that are relevant to their roles, but program coordinators should be attending every virtual training session. We do have a few minutes left here. If you don't have any questions for us, you can just go ahead and log off. But we'll hang around just a little bit longer in case you did have any outstanding questions. Otherwise, we'll see you at 1 for those of you that did register for the RMTS session. Thank you, Marie. Thanks for all your insights too.
Anytime. Thank you. See you at 1.
See ya. Thank you, Teresa. Thanks for attending.